Hello and welcome everyone to SAIA's Gastro Gyan series. I'm so honored to have Dr. Patel here for some of the questions regarding injections and infusions. Real quick, my name is Aisha. I'm based in California. I'm a Crohn's disease patient advocate with SAIA. Dr. Patel, I'll hand it to you for introducing yourself, and then we'll get started.
Thank you, Aisha. I'm Dr. Sanket Patel, and I'm the Director of Crohn's and Colitis Center here at Virtua Health in South Jersey, and Clinical Assistant Professor at Rowan Virtua School of Osteopathic Medicine. And I'm an IBD patient myself. My practice focuses mainly on delivering high quality care in a multidisciplinary way here in South Jersey. I do intestinal ultrasound, and my goal is to really improve patient education and access to care. I'm passionate about helping patients better understand their treatment options so they can make informed decisions and really live well with IBD.
Thank you, Dr. Patel, for that work you do. It's so important, and that's one of the missions of SAIA is to create more awareness in our patient community. So let's get started. When and at what point are injections or infusions part of the treatment plan for IBD?
So that's a great question. It often comes up during my conversations with patients. Infusions and injections are a way of giving medications. I often tell my patients it's a way to help calm down inflammation in Crohn's disease and ulcerative colitis. Infusions are given through an IV that can be done in the clinic or hospital setting. It can also be done in your home where an infusion nurse can come out and place an IV and, infuse the medication in the comfort of one's home. We use them when oral medications are either ineffective or maybe not an option for patients. And so it is important that infusion and injections are just a different way to deliver the medication, just like oral medications are. And it really is helpful in preventing flares, really preventing complications like hospitalizations, long-term bowel damage. Our goal with these infusions, injections, and oral medicines is really to get you well and keep you well.
Thank you. Also, Dr. Patel, how do we as patients prepare for infusion day? So a common problem that happens in my case is, regardless of, very experienced nursing staff at the infusion centers, sometimes it's just really hard to find that vein. It takes multiple attempts. It's just something that I feel like is a recurring problem. So I wanted to find out if there's some things that we as patients can do to prepare either, the day of the infusion, day before, something we can do that will help prevent that kind of a scenario.
Yeah, it is very important to sort of prepare yourselves, whether it's mentally and sort of emotionally. The other big part of this is access, right? Staying well hydrated the day before or the morning of your infusion makes a big difference. A full vein is easier to find, and the nurse can easily access that vein. Eating a light meal before you arrive at the infusion site or before your infusion is set can help. Really is important to not get low on blood sugar and just have a light meal will be important in that regard. And then keeping your arms warm with a heating pad or like a warm compress really helps to dilate the vein also. If you've had trouble before, would recommend that you let the team know because then they can prepare. They can help to, have the most experienced nurse try, and or there may be an ultrasound available on site where they can use that to place an IV or a vein finder. And wear loose sleeves so they can access your arm much easier. I think those would be my sort of overall highlights on how to prepare for your infusion day.
Got it. Also, Dr. Patel, about post-infusion care, is there any recommendations you can provide?
Yeah, so post-infusion preparation and really awareness, I like to call it, is important because after infusion, most people can go about their normal day and normal activity. Some people may feel a little bit tired, but there's some things that you may need to be aware about, especially things like fever, rash, shortness of breath, joint pain. Yeah, if you experience or any sort of new or unusual symptoms, let your care team know right away. Otherwise, you can resume your usual activities, diet, exercise, and, drink plenty of fluids, stay hydrated, and rest.
And then what about when patients are like self-administrating subcutaneous injections, right? Do we still require like a similar kind of prep for that?
Not as much for injections. It's mainly about comfort. Let the medication, maybe warm to room temperature for about 15 to 30 minutes before using it. Cold medicines can sometimes sting more. Rotate the injection site, whether it's the inside or the outside part of your thigh on the right side or the left side or the belly. If you're anxious about pain, you can use an ice pack before or after. Hydration isn't as critical as it is for infusions, and with the IV necessity, but really being relaxed and comfortable helps.
Got it. Regarding infusions, as a person without the medical background, I feel like in our community, there's a lot of fear for anything that's like injections or infusions. And, sometimes they're seen as, oh, you should wait, make that the last resort. Another question that comes up is, are these infusions, being scheduled in infusion centers, are they considered or classified as chemotherapy medication? So, can you help us kind of demystify this? Because there's a lot of anxiety around this topic.
Certainly, and I can relate as a patient because I remember, getting my infusions and, you know, in the days of Snapchat and other social media, when I would send it to my friend, they would sort of respond back, "Are you okay? Is something wrong with you? Are you hospitalized?" Not necessarily thinking that, you know, um, infusions can be given for, just delivering medicines, whether it's home or in a clinic setting or in a hospital setting. So there is a stigma around it, certainly. And so, but it is important to understand that at the end of the day, these are medications just like any medicines. It's just a different mode of administration. Um, and the question of chemotherapy really it comes up quite often in my clinical practice. Um, no, they are not chemotherapy. They are targeted precision medicines, biologics, and small molecules that they really are targeting specific parts of the immune system. They don't work like cancer chemotherapy, which really affects the rapidly dividing cells all over the body. I like to give analogies to my patients in the office to really help understand this and drive home the point. And I'll give you two analogies. One I really like is of a stereo system, right? Where if you imagine the stereo system producing music, and you turn that dial all the way up, there's a lot of noise. And so that's like inflammation and inflammatory bowel disease. There's a lot of noise, and our goal is to fine tune it and tune it down to sort of a level where we can enjoy the music. That's like biologics and advanced therapies. They're really dialing down that immune system to a level where it can work more effectively. Whereas the chemotherapy is like unplugging that stereo system or hitting a mute on that stereo system is really how I like to explain it. So really, it is precision therapy where we're really targeting specific parts of the immune pathways. Another analogy I like to give to my patients is like a wildfire, where you have inflammation and there's a wildfire that is, we want to put out. And so one of the easiest way would be to send in a helicopter or an airplane with a bunch of water and douse the fire and put it out. Now, short term, that is great, but long term can have a lot of consequences for that forest, for example. And so when we sort of put out the fire, we want sort of like a sprinkler system. We want something to sort of, keep that inflammation at bay and really, prevent that inflammation or the wildfire from returning. So biologics are like that sprinkler system. So really, not waiting as a last resort with these options is really important. And it can actually be really risky if we use them as last resort because uncontrolled inflammation can cause irreversible damage and can lead to complications, including surgery. The best results come from using the right treatment at the right time for based on the disease risk factors and severity.
Thank you, Dr. Patel. That analogy really helped me understand that there are different, depending on the case, obviously, and the situation the patient is in, there's these different modalities, and each serves its purpose. But then we also have to think about what's sustainable and what helps the patient long term. So thank you so
Yes.
much for answering all these pertinent questions regarding IBD care and IBD management. On behalf of SAIA, I want to thank you for your time, for attending, and I also want to thank the audience for tuning in. Please be on the lookout for more of these Gastro Gyan series where we come to you with a IBD specialist on board and ask all the pertinent questions. Thank you again, and have a great day.